So let's talk about sleep apnea, something that I deal with a lot of my patients. And I want to help you kind of make it through the muddy waters of what sleep apnea is, why you probably ought to know about it, and probably why you ought to do something about it if you have it. So have you ever woken up in the middle of the night gasping for air, or noticing that your mouth is incredibly dry? Or worse, have been told that you snore like a chainsaw? Well, you might just have sleep apnea. Now, quick statistic. An estimated 1 billion people worldwide suffer from sleep apnea, and many are undiagnosed. So before we dive into this global epidemic, discussing what causes sleep apnea, why it's so common, what treatments work and which may not, and whether new high-tech devices like Inspire are worth considering, please rate and review this podcast on the platform you're listening on, and make sure to tell your friends and family so they can enjoy it too, if you like it. So the definition of sleep apnea is actually repeated pauses in breathing during sleep. It's often due to the tongue falling back into the back of your mouth, blocking your airway. Now, there are many other causes of sleep apnea, including what's called central sleep apnea, which we're not going to talk about today because it's a totally different treatment. But most sleep apnea is caused by a disturbance in the upper airway. Now, this can be caused by multiple factors. Sometimes it's as simple as that you have not a very large lower jaw, and that your lower jaw, interestingly enough, has been getting smaller and smaller with the passage of years in studying humans, like I do. We used to have a pretty big lower jaw, but one of the theories of why our lower jaw in particular has become smaller is we no longer need an aggressive jaw to eat the food we eat, because most of our food is cooked and then pulverized into a fine powder, or we're drinking a smoothie. So we really don't have much use for a large jaw anymore. Be that the case, many people who do have a smaller lower jaw do suffer from sleep apnea because, quite frankly, there's not enough room in your mouth for your tongue. And that as your tongue rests literally on the back of your lower jaw, in some people, when they sleep, the tongue tends to drift backwards, closing off the airway. And that causes oxygen levels to drop in your blood. And if you're lucky, that fall in the oxygen level suddenly stimulates you awake, and you take one of those sudden deep breaths, if you're lucky. Unfortunately, a great number of people, because it's happening for so long and so often, that reflex of either oxygen falling or carbon dioxide rising no longer is very vigorous. And so many of my patients with sleep apnea, when we do oxygen tracking on their sleep, will have SpO2s, partial pressure of oxygen, in the 70s or 80s, whereas really the lower limit of normal is about 90 to 92. And they're totally unaware that half of the time they're asleep, they're profoundly hypoxic. They're deprived of oxygen, and they're totally unaware of it. In fact, I have a good friend who is a cardiologist, who his wife really hated sleeping with him because he snored so bad. And we happened to have gone on vacation with him, and they were in the bedroom in the hotel next to our bedroom, and we could hear him through the room. And because he's such a good friend, I said, do you know you have sleep apnea? He said, oh, no, I don't have sleep apnea. Are you kidding? I said, I'm telling you, you got it. Go get checked. Well, so he got sleep study, and the doc who did a sleep study said, quite frankly, I can't imagine why you're alive and how you could possibly function as a cardiologist, because you have some of the worst sleep apnea that I've ever seen in my life. And he had become so chronically used to this, that what he thought was a normal day and how he felt going throughout the day and how tired he was because he was a very busy cardiologist. But the point is, he had severe sleep apnea. And now that he's on a CPAP machine, luckily his wife now sleeps with him again because she couldn't take the snoring. But his activity at work is sterling compared to what he thought. He was just tired all the time from a bit busy practice. I first started getting into sleep apnea when we used to have a really fantastic blood test for very subtle myocardial ischemia. That means the heart muscle is not happy. Many of you know that if you think you're suffering from a heart attack, you go to the emergency room, we draw some blood on you, looking for troponin T, which is a measurement of heart muscle damage. And if we see it above a level, or if we're seeing it rising, boom, you have a heart attack. Well, a particular company that's now out of business invented a test called Troponin I, which was 100 times more sensitive to this heart muscle damage than the test we use in the emergency room, Troponin T. And we used to get it on all of our patients. And one of the early striking findings is we'd have people with absolutely normal coronary arteries by a stress test, by a CT coronary angiogram, by a cardiac catheterization. And yet they'd have these low-grade troponin I. And so I said, gee, I wonder what else could be causing this. It's certainly not coronary artery disease. And lo and behold, there were several papers implicating sleep apnea with elevation in troponin levels in patients. And so I started taking my patients with this elevated marker, getting a sleep study, and finding almost universally these patients had sleep apnea. And the minute we started treating their sleep apnea with a CPAP and showing that it was working, lo and behold, their troponin I's went down to normal. And who would have guessed that every night their heart was basically having a mini heart attack that they were completely unaware of? And certainly I would have known about it without that sleep test. The other reason I see it is we have another hormone that your heart makes called NT-proBNP. And I promise there won't be a test. We call it the heart happy hormone, because it's a really good, subtle way of seeing how hard your heart's working. And we can use it to pick up leaks in valves. We can even use it to watch who's exercising, who's not exercising. We can use it to look for myocardial ischemia. But we also notice that patients with this slightly elevated BNP, that we assumed, they're just getting old and, maybe they got a little leak in a valve. When we diagnose sleep apnea with them and put them on CPAP, lo and behold, this heart happy hormone returned to normal. So the reason I'm telling you about all this is a real silent killer of your heart and your brain, and not just a problem with you snoring like a sailor, like a chainsaw. So that's why you should be interested in finding out if you have sleep apnea. Why doesn't everyone have it? Well, everyone doesn't have a small jaw. But one of the other factors that has prompted me to get sleep studies through the years is that amazingly early on, when we started having success in weight loss in my clinics, and again, I've been doing this for 30 years now, 6 days a week, lo and behold, the spouse or significant other would say, the biggest benefit is, he feels better, but he doesn't snore anymore. And so one of the first things we did with people who we diagnosed sleep apnea is put them on my weight loss program. Or people who hated their CPAP machine and wanted to get off of it. How did we do that? Well, we like to store a lot of fat in our mouth, in our neck, and that fat literally narrows the airway and makes, quite frankly, our tongue fattier. And just reducing that fat in the neck and the tongue area has significant benefit for a large number of people with sleep apnea. What else can do it? Well, alcohol is notorious for causing sleep apnea. Sedatives are notorious for causing sleep apnea because they really relax the airway muscles. And a poor diet. Reflux can certainly contribute to sleep apnea. And one of the first things I do with my patients is I get them off of their back sleeping. Because think about it, when you're on your back sleeping, one of the first things that can happen is that your tongue can roll backwards. On the other hand, if you sleep on your side, particularly the left side, and there are now pillows that are specifically designed that you can order on Amazon that will force you into a left-sided sleeping position. That not only keeps your tongue from rolling in the back of your mouth, but also is very effective at preventing reflux, which can cause spasm in your lower airway. Enlarged tonsils, enlarged adenoids. This is more a problem with my younger patients, but many people still have their tonsils and adenoids, and this can be a factor as well. Now, interestingly enough, women seem to not get this until they become postmenopausal. Now, whether that's because so many postmenopausal women start to gain weight that they didn't have beforehand, that may be a factor, or it may be estrogen is a useful hormone to keep muscular tone in the head and neck. And I think the research is not clear yet. So what are the red flags? Well, I've told you all the ones that I see in blood work. But again, snoring is a classic. You're not supposed to snore. Gasping, choking sounds, morning headaches is a classic. Waking up with a dry mouth is almost certainly a sign that you are mouth breathing rather than nasal breathing. Daytime fatigue, poor focus, irritability. Again, my very good friend, the cardiologist, thought that was a normal part of his busy cardiac lifestyle. In fact, it was his sleep apnea. If your partner is complaining, please listen. Do not say, you're making it up. I don't snore. In fact, I always have the significant other in the exam room with my new patient because that's one of the first questions I ask. Does he or she snore? And they usually say, yeah, like a chainsaw. And I do not. I've never snored in my life. So ask your partner, do you snore? And ask for an honest answer. Restless legs can be a sign of this. Tooth grinding can be a sign of this. And really weird mood swings can be a sign of this. Do you want to do a sleep study? Yes, you do. Now, let's be frank. Most sleep studies are a pain in the neck because they want you to come into a sleep lab. And I've never understood how anyone could possibly go to sleep in a sleep lab, wired up. Luckily, there are many sleep labs that now do at-home studies. There are several companies that make some very interesting monitors to look for sleep apnea. There are even tracking devices like an Oura Ring or like a Whoop band, which is buried back here, that will look at oxygen changes during your sleep and quantify it and show how long it happens, how often it happens. Recently, I had one of my patients who had these devices, and the devices weren't really giving her much bad information. She got one of these oxygen trackers, sleep trackers, and brought it in to show me. And this is a very healthy, energetic woman. She had some of the most impressive drops in oxygen saturation in this healthy female that I'd ever seen. So needless to say, we're getting a sleep study on her. This is actually new information. So there's lots of ways now to start looking into whether this is happening. But one of the best ways is your partner telling you snore. Okay, so what are the treatment options? So the traditional treatment option is CPAP. That stands for Continuous Positive Airway Pressure, CPAP. It's a machine that delivers pressurized air to a mask or to nasal plugs that keep the airway open. And it's titrated to exactly the amount of pressure that you need to keep your airway open. And so most sleep studies, if they find sleep apnea, automatically do a CPAP test and titration to see what will work for you. Quite frankly, many people don't like initially that feeling of that pressure. And so a good sleep study center will actually titrate your CPAP to what will work for you, but will also be tolerant for you. Now, it is the gold standard. It's proven to reduce sleep apnea episodes. It lowers blood pressure. It improves daytime energy. And there's no doubt about it. There are definitely cons. Some people hate the mask. They almost feel like they're smothering. Again, there are other options now. There's nasal CPAP, which is becoming more popular. There's fitting issues, and you've got to find a mask that's comfortable and fits. And compliance issues. You got to keep the dumb thing clean. You have to travel with it. Luckily, there are many portable CPAP machines. You probably see them going down the aisles of most airlines these days. They're easy to travel with, but there's no doubt about it. You've got to get the benefit. You actually have to see the benefit, either on blood work or how you feel, for you to stay with it. It's safe overall. It reduces cardiovascular risk, and you got to use it consistently. There are certainly other approaches. Like I said, I'm amazed at how many people we can get off CPAP by simple dietary changes, by putting them on their left side, by weight loss. Even such things as mouth taping can be useful to force you to breathe through your nose. There are devices that trained dentists can develop and use to pull your jaw forward. I've even had one patient take the extreme effect of breaking both of his jaws and expanding his jaw to open up his mouth. Now that's extreme, but it worked incredibly effectively, and he had a very small lower jaw. So there are all these alternative approaches. Surgery can sometimes be used for taking out, if it's lymphatic tissue, adenoids, and tonsils that are the trouble. But that's really way down the line. Now, you've probably seen all these commercials for the new kid on the block, the Inspire implant. And there's a bunch of these guys on CPAP having a meeting, and there's this young, healthy guy saying, oh, geez, I don't use that anymore. And everybody's incredulous, and they're tearing off their mask. And he says, I've just got the Inspire. What the heck is it? Well, it's an FDA-approved implant that actually stimulates a little nerve in your neck called the hypoglossal nerve. And it actually is what stimulates your tongue. Now, I know a lot about the hypoglossal nerve because as a vascular surgeon in the head and neck, in the carotid artery, we always identified the hypoglossal nerve, which runs in the carotid sheath, because if we damage that nerve, your tongue on that side didn't work. But clever researchers learned that if you periodically stimulate that nerve, you will actually contract the tongue, and the tongue will not fall in the back of your throat. There's a sensor implanted in your chest under the skin. Now, the sensor detects breathing, and it sends mild electrical signals to keep the tongue moving forward. Now, the pros, there isn't any mask. Now, it improves quality of life in people who can't tolerate CPAP. And the evidence shows, and the reason it's been approved, is that it does have a significant reduction in these apneic episodes and in daytime sleepiness. Are there cons and limitations? Well, yeah, it requires surgery. It requires follow-up programming. It's not for everyone. The FDA has strict requirements. There are BMI, body mass index requirements, and you right now only qualify for moderate to severe sleep apnea, not just the everyday. And it's expensive. And so far, it's iffy whether insurance will cover this, so you have to check. There are safety concerns. It does use mild electrical stimulation. And like any implant, and I can tell you, having put thousands of pacemakers and implants in my patients, there are risks of infection with these devices. There's risk of discomfort from these devices, and hardware can malfunction. But it uses a good principle that kind of pulling the tongue out of the way may be useful. But in the meantime, lifestyle modification is still The number one thing I do with my patients with sleep apnea, with my CPAP dependent patients who want to get off CPAP, and it all comes down to, take care of your body with the food you put into it, and your body will usually reward you by taking care of you. More amazing episodes just like this one. Watch now. Now, the problem with milk in your coffee or tea is that milk contains sugar. But good news, heavy cream has no sugar.